Today is October 15, Friday 2021. So, um, yes, I was wrong. I thought I was working on Saturday, but actually, I'm working today, which is Friday, which is just 2 days after my 3 long day shifts. Um, Today was a very bad shift and traumatic even. So once again we were short. We only had 3 nurses, so I had to be in charge. Then there was a band 3, which is basically a nurse from another country waiting for his NMC pin, but he's never handled patients. And the most ideal situation would be if he's to start taking patients, there would be a PDN or practice development nurse with him. But what happened today was they put so he was rostered like he is one of the nurses, and he has no access to medication. He has never taken patients before here in the UK. And so I had to be the charge nurse, but also take on 6 patients. And the patients that I had were actually the busiest one. So there was 2 patients that I had to do NG tube. We had 3 patients with catheter, which we had to monitor the urine output. And then the other patient was initially for end-of-life care, but this was reversed because he was doing a lot better, so we had to do all the treatments again, all the IVs, all the antibiotics, and all the special treatment. So one thing that happened today that I need to share to you guys is that the patient I mentioned before in my previous diary is still here, and today it was already around 10 o'clock, and then the consultant came and was asking why the blood sugar has not been checked yet. This is the same person who threw that knife at me. So I was a bit hesitant to go in and help the nurse who was working there, to be honest with you. But as a charge nurse, I have to step up to the challenge. We were only 3 nurses, so me and the other nurse, and then I had to call the occupational therapist to come with as well. So basically, she was refusing again for her blood sugar to be checked. And so we had to go in there and have like a show of force. So what we've noticed before is that if there are 3 or more people, she will just expose her arm so that we can do the insulin, or we can take blood from his finger. But so what happened today was, at first we managed to convince her after we had a show of force of 3 people there. We haven't touched her. We're just on the sides, one on the right, one on the left, and then the nurse was having the CBG machine to do it. Now we had to do both the ketones and the sugar because the consultant asked for it and she was waiting outside. So when the nurse was doing it, we managed to get so when she got the blood sample for the sugar, she thought it was finished. She put it there. Then she got the blood sample for the ketones. The ketones read fine, but then the CBG, it said that the sample was not enough. So we said to the patient that, oh, we need to get another sample because it didn't work. Can you let us try again? And suddenly, out of nowhere, she took the CBG machine, threw it on the wall, and it smashed on the wall. And then I think she was about to get something else when I was taking a step forward, and suddenly she stood up. And then, so what she did was she, with her right arm in a fist, she beat me like 1, 2, 3, like with full force, and then it hit me here 1, 2, 3, and then to stop her from continuing to hit me, I shielded myself with my left arm and she hit my arm like 3 times. So, um, so that happened. So the instruction was basically if she starts to get agitated, we had to step back, get out of the room, leave her for 15 minutes. As I was going through on my busy day, doing all my patients and being in charge at the same time, people, everyone coming to me, the physiotherapist, diabetes nurse, dietitian, speech and language therapy, the doctors, junior doctors, porters coming to me, whilst I was also having my own patients. While I was still catching up with my medications in the evening, and when I was doing the system for the medication, I noticed my hand, and I saw that it had changed color. So I don't know if you can see it from the light here, but it's actually properly bruised. Look, so you can see this one, the purpling there. I mean, my hand is okay. So this is my okay. So this is normal hand color. This is like fully bruised arm, and it is actually painful. And I'm just like, this is not right. The assessment unit is a very acute ward. Patients are very, very sick, and it's very fast paced. We move patients immediately within, like, sometimes even within the hour from A&E. We receive them, and then if the results come back, we just immediately send them up. So we, instead of just having 6 patients in a day, you can actually have met and cared for like 12 patients just for yourself, because you've cleared the area and then you've got new patients. It's very fast paced, and it's not helpful at all that we have this kind of patient who doesn't have any acute medical problem, who only causes strain, pressure, and on this occasion, physical harm to the nurses. So yeah, it's just not right. She's got no more medical problems, so that's all I can say. Otherwise, and it's very. I feel like I'm just at the tip. I'm just at the end of my string, and yeah, no. I'm not gonna stay in this place. I mean, these things happened before with a different scenario, but it's always us in the medical assessment unit that has to handle the worst patients, and for some reason, um, the wards upstairs manage to avoid accepting these kinds of patients, they, for one reason or another. And it's actually better for them to go upstairs because it's a long stay ward. The environment is more or less the same, even for weeks, even for months. And with that, they get used to the environment, they adjust, and they know the people. So with the medical assessment unit, patients change daily, nurses change, especially with this kind of shortage. There will be staff from other wards, there will be agency nurses, there will be bank nurses, bank HCA, so it's never the same. So it's a very fast-paced environment. It's not good for patients with, with mental health or cognitive problems or dementia, because the best thing is for them to have a stable, constant environment that they can get accustomed to, not this fast-paced environment. This is not the best place to treat these kinds of patients. And yeah, I think for me, no, this is it. This is the limit. Me being physically abused and actually hurt, and having this bruise and pain. I haven't checked my chest yet because she hit me like several times there as well, but I can feel some pain there as well. So I'm sure that's in a few hours or maybe tomorrow that's gonna bruise as well. And the frustrating thing is I can't report this to the police because technically she's a patient, and they will argue that she doesn't know what she's doing. I won't say anything about that. Basically, there's nothing I can do except to do a DATIX, which is basically an incident report that only managers read, and I don't know. To be honest with you, there's not much that can be done, and that's why I have to leave this place. So this is the last straw, really. No, I give up. I'm not having it anymore. I deserve better than this. And I know myself, and I know how much skills I have, how much training I have, and I can be a lot more useful, and I can do a lot more things in a different environment, and I can grow and improve more in a different environment, not in this pressured, never improving, always dumped with the most difficult patients kind of place. And just today, there was a doctor who was with us like about 4 years ago. And then she saw me, and then we greeted each other. I was like, "Oh, welcome back." And then she's like, "How was your shift?" "Oh, it's not very good." Blah blah blah. I was hit with a patient and all that. And then she's like, "You know what? You're the only, you're the longest survivor in this ward." That's what she told me, and I was like, "Yeah, that's actually true." Like, if you look back 5 years ago or 6 years ago, the only face that's still the same is me. Yeah, all of the nurses are new. So yeah, no, she was right. I'm the only one um, who had so much patience to stay in this area. So no. To be honest, earlier I really felt very emotional, and like I even wanted to cry. Like, why do I always get? No, not just me. Like, why do we nurses in the NHS always get this type of abuse? And my only option now is really, you know, to remove myself from this environment. It's not healthy anymore. It's not healthy physically. It's not healthy emotionally for me. So yeah, I don't blame all the nurses who've left, and I'm happy for them that they found their happiness in a different setting somewhere else. And I think it is time for me to do the same. So I leave it at that because it's actually past 9 o'clock now, and I'll go home. I did go to A&E earlier to see if there was a GP that I could, have like a quick assessment for this and for my bruising and for my chest. But I said there's no more GP after 8, so never mind. If I have some pain, I'll take paracetamol. Other than that, there's nothing else. So yeah, it's buy time now.